Back in the fall of 2006, I was training for a mountaineering trip, and I noticed I was having some stiffness in my left hip. Felt like a groin pull. The pain got worse, and I'd have discomfort walking, taking my two dogs for a walk. So by the time February rolled around, I had no doubt that I wanted to go ahead and have the surgery. I had to decide between total hip replacement and hip resurfacing, and it was one of the reasons I came to this hospital, because I knew Dr. Kantor could give me either one. So really the decision for me was easy. I talked to Dr. Kantor. He looked at my case, my age. You know, we talked about the different technology, and I really left it up to Dr. Kantor after, you know, understanding the positives and negatives of both procedures, and we decided together to go ahead with a complete hip replacement. Maybe a couple hours after surgery, Dr. Kantor came along and stopped by, said, "Hey, would you like to stand up and take a few steps?" So he got me to sit up on the bed, and I took a few steps with the aid of a walker. And it was really pretty amazing to be 3 hours after my surgery, I'm standing on my new hip. You know, the education I received prior to surgery was right on. If you're going to have complete hip replacement, you know, I went into the hospital feeling pretty good, but it's a pretty, you know, serious operation, and they really set my expectations as far as I knew what type of, you know, road to recovery I would have. The first 5 to 7 days that I was home, I was really challenged. It, you know, takes some work, takes some effort. You know, your hip isn't feeling as good as it was prior to the surgery at that point, and that definitely takes some effort, some willpower. But the thing that I found was every day, almost every hour, you start to feel better. You start to feel the strength coming back in your hip. And the thing that's really key is the physical therapy. So they want you to start that. You start it prior to leaving the hospital, and then it's something that you have to continue. So, you know, I guess my advice to someone would be, you know, follow their instructions, take the medication, and again, do the physical therapy. I think maybe 2 days after I was home, the physical therapist arrived, and I'd been doing the exercises. But really, when she came, she really pushed me more than I thought I needed to go, or maybe wanted to go. In my first session, you know, when we were done, I got up and I walked with a, you know, walker. And before she left that day, I said, "Hey, let me just see how it feels with a crutch." But I really learned something very valuable. Physical therapy is what would help me get back on my feet much quicker. What people should consider is, what's your lifestyle? And so, you know, my goal is to get back to the lifestyle I like. And I think what this surgery allows, you know, anybody, depending on what their lifestyle is, what they'd like to do, you can get back to that. You know, things that I like to do, road biking. I'm 4 months from my surgery, and on Saturday, I did a 60-mile bike ride. I would like to say the most surprising thing about having a complete hip replacement was it really wasn't a big deal. I was really, again, not having surgery, you know, I was ready to have it, but I was a little apprehensive. And I've got to tell you, I was worried about the pain. Am I going to feel a lot worse? How will I feel after recovery? What's going to happen? Will the drugs helped me cope with the pain, and I can remember sitting up in bed the next day, really going, this is a lot better than I'd expected. And I'd say all through my journey from surgery to recovery, you gotta remember it takes some effort. There is some discomfort, but it was well worth it. And I won't hesitate again to have my right one done.